Janet Elko knew the moment she needed to make a change. It came during a trip to the Grand Canyon with her eldest son.
And I had always wanted to go there, never had a chance.
But back and knee pain limited her activity, a tough situation for someone who loves nature and walking outdoors.
I was in a lot of pain, and at that point I thought, this trip is just not turning out to be what I wanted it to be. And I spent a lot of time just sitting and looking at other tourists having fun, and I wasn't having fun.
Back home in Wisconsin, Elko saw her primary care provider, who connected her with physical therapist Rachel Avelalema.
It's always kind of like a puzzle piece when someone comes in. There's no one size fits all. You have to work with the patient. There's no cookie cutter answers.
Physical therapy led to progress in some areas of mobility, but there was still a missing piece. Elko had another decision to make.
I had to be honest with myself. Even though I wanted to turn 80 with all my original parts, I had to face facts that, something, the next level had to be considered.
That's when she met with Dr. John Watkins, an orthopedic surgeon at Marshfield Clinic in Minocqua.
And the back can be the great masquerader with any lower extremity issue. Throughout the evaluation, we kind of defined that majority of Janet's symptoms were coming from arthritis in her left hip.
Together, they agreed. Total hip replacement was the next move.
So the number one thing is I want to make sure the patient's the one driving this treatment. I'm the one that thinks my quality of life is not where I want it to be.
And I was convinced this was the time, this was the surgeon, this was the plan.
Joint replacement surgeries are big deals, and it takes a lot of moving parts to, one, have a good outcome and to make it efficient and enjoyable for patients.
On her road to recovery, Elko had one request: reconnecting with a teammate.
I asked if I could see Rachel for physical therapy because I just believe in her.
You're with each other so often that it almost becomes more like family. You create a very strong relationship of trust, and that, helps success too.
Elko says it all just came together, and within a couple of months, her back pain and leg pain were gone. She was walking with confidence again.
It's cool. It's awesome. It's what you would want for your husband, your dad, your sister, right? Is to see them succeed in everything they want to do in life.
Over Easter weekend, Elko traveled to visit family. She took a big step forward at the airport.
I could walk on the moving sidewalk without tipping over.
And another while walking an outdoor trail.
I went up and down those granite steps that they have on the trail, and I thought, I can do this. I can do this again. This isn't going to keep me from doing the things I enjoy.
And that's extremely rewarding when you can be a part of that.
What we care about is that you were able to do what you wanted to do, right? You were able to see your son, you were able to go explore.
Elko has more exploring ahead.
I have family and friends and grandchildren doing great things, and I want to still be a part of that.
And she hasn't ruled out a trip back to the Grand Canyon.
I thought about it, but there are other places I'd like to see too.
In Minocqua, Justin Wolf, Sanford Health News.